Well, welcome everyone. I'm glad we're having you with us tonight. It's a great experience to be here with Dr. Emerson, Dr. David Emerson. We are having this initiative for this programs that we're starting with the help of Emerson's Clinic and also Hartland Wellness Center. And we're really glad to have you with us. I know that some people are just connecting. We're using the platform and YouTube to do this program, and we're hoping to have many more and to have you with us. And please share this with your friends. The topics we're going to be talking about, they're very serious. They can be very helpful. They can save lives, actually. And this is why we're here, because we want to be a blessing to all of you. I'm actually so glad that we're doing this, because especially when we're talking about cancer, this is close to my heart, because I even want to ask all of you a question, but not now, because I know many people are still coming. In my family, I had 2 people that had cancer, and I wish back then that we had more information that we could have prevented, or we could have further the life, the well-being, the quality of life of my family member. I'll tell a little bit more about in a minute. And this program is so important because we, as the Wellness Center here at Hartland and the Emerson's Clinic, there's so much valuable content that we give to our guests and the patients that come here, and they leave here. They're so glad that they come, and many of them don't even want to leave. And we understand that we have a limited capacity, and we cannot take a lot of people at once. And we decided to do this so we can reach more people. Now, we're not limited to time and space, or time, yes, but not space. We'll go across the internet, and we can help and bless more people. So that's why I'm really glad we're doing this. And I hope you'll be blessed tonight with tonight's presentation. We're going to have a little conversation. This is a podcast style, so it's live. It's not like a full lecture that we're doing, so bear with us. I'm sure you're going to like this format. And like I said, today the topic is going to be cancer. We're going to talk about some other serious illness, but cancer will be the focus. There's some statistics that are really alarming, and I'm sure you don't want to be part of the statistics, and none of us want. First of all, I'd like to thank Dr. Emerson for being here with us tonight. He works really close to us here at Hartland Wellness Center for quite some years. He's going to talk a little bit about that. And I want to start actually asking this question. Who is Dr. Emerson? Tell us a little bit about your story.
Well, I was raised in California, went to medical school, and then went to Kettering Medical Center for internship in internal medicine. And when I finished there, I took my new bride out to Guam, a little island out in the Pacific. And there, right after World War II, they didn't have any significant medical problems. Diabetes was unknown, heart disease was unknown, but when we went there in the 1990s, diabetes had become their #1 problem, heart disease #2 problem. Some people say, well, was it genetic? Well, of course, genetics don't change that fast. Was it diet? Yes, their diet had changed. They had adopted the American lifestyle, and it was devastating to them. Then after about 8 years serving out there in our little Seventh-day Adventist clinic, we came back home to Oklahoma, setting up a clinic there, and we treated patients in the hospital and in our clinic. But when we were setting up the hospital, our introduction to Oklahoma, we were going to Oklahoma City getting some supplies, and I asked my wife, I said, Olita, can you please ask this gentleman on the sidewalk here where we can find a vegetarian restaurant? So I pulled the car over. She rolled down the window. She said, excuse me, sir, is there a vegetarian restaurant nearby? And cowboy, big hat, big cowboy boots, walked over and said, lady, this is cattle country. And so that was our introduction to Oklahoma. We found they had the same lifestyle problems there. So we set up lifestyle program in the evenings where we would teach them to do plant-based diet, cooking classes, feed them the good foods, and in a week's time, they'd had tremendous results. Weight coming down, blood pressure's dropping, cholesterol's dropping. But they were our patients, and we would see them in another 3 months. And in 3 months, they weren't on the program anymore, and that was a very difficult thing. Compliance, being able to stick with the program was a real challenge there, and we find that it's a challenge in most places.
Yeah, and we're going to talk about that. This is a really important thing because people usually are looking for quick results and quick fix, and they might join a program or go to the doctor or and expect that their problems will be solved. And we're going to learn that's not quite this way. There are some changes that need to be made. Now, the question is, you've been associated here with Hartland, and Hartland all these years have been treating many illnesses, many guest patients with all kinds of illnesses. And recently, there has been a focus, a shift, like a little bit of focus on cancer. And why is that? In
1900, the lifetime risk of getting cancer in one's lifetime was 1 in 40 people would get cancer. By the 1940s, it was 1 in 20 people. 1980s is about 1 in 10. Now it's about 1 in 3 people will get cancer, and we're moving towards 1 in 2. So cancer is on the rise.
Well, let me take the chance, since you're mentioning this, let me ask the people that are watching us. I think this is a right time to ask. If you're watching us on YouTube, you can write on the comments. I would like to see that. How many of you that are watching know at least one person from your family that has had or have cancer? Let me see what you have to say, because you just mentioned an alarming statistics that 1 nowadays out of every 3 people will have cancer in their lifetime. That's serious.
Yes.
So please tell us on the comments, and I'll be looking there. Now keep on.
Sure.
On your.
So when we came to Maryland, to our ancestral home in 2013, Elder Restrepo, the president here at Hartland, invited me down to help out at the Hartland Lifestyle Center, and we treated a lot of patients with diabetes, heart disease, coronary obesity, hypertension, but we started seeing more and more cancer patients, and gradually our focus started being directed toward cancer patients and trying to find modalities that have been found to be useful in the past as a cancer support. One of the problems people face when they're diagnosed with cancer is everybody in their neighbor has a protocol to give them, and there are more things than can possibly be done in any 24 hours. And so what we've done here is we've tried to look at what's been tried in the past and what has been associated with the best outcomes, and then trying to make those available to the people that are struggling and fighting cancer. And whether they're doing standard, treatment of cancer, chemotherapy, radiation, surgery, or whether they're avoiding that to avoid the side effects, either group we can help with supportive measures, including diet, intravenous vitamin C, hydrotherapy, getting the temperature up, intravenous vitamin C, and thermal hydrotherapy. These modalities can be a complement to whatever modalities they're getting in their in standard medical care.
Wow, yeah, some people are a bit shy right now, but they're already responding. And the other day, for the weekend, I've asked the audience how many of them knew someone. All of them pretty much raised their hands. This is a serious thing. I would like to also ask you that are watching if you can actually put where are you from? Where are you watching from? That would be nice for us to see. I see here that we have with us Corrine, Victor Parson, Greg also with us. And right now we're having about over 30 people watching, so that's really good. Now, going on with the question is, what have you noticed that are causing this rise in cancer? I mean, what are some of the causes for this?
Big thing appears to be dietary. They did some studies, epidemiological studies, where they looked at different countries, and they looked at the amount of fat intake per day for the people in their country. And they found that the higher the fat intake, the higher the breast cancer mortality rate for that country. It was a fairly close relationship. Then they asked the second question, was it plant fats or animal fats that showed the closest correlation? And when they plotted the mortality based on plant fats, there was no correlation, which shifted the correlation back to animal fats. And so simply going on a vegetarian, a vegan diet can be a big step towards trying to prevent and avoid many types of cancers. There's sometimes confusion as to the terms. Vegetarian means avoiding the meat products, anything with the face, anything with the mother.
That's right.
That's a vegetarian. If you also exclude dairy products, that's what we would call vegan, generally. And then if you want to go a step further in a healthy diet, you would avoid the free oils, the fats in the, say, the olive oils, the salad oils, cooking oils, fried foods, and that would be moving more towards an optimal diet. That is one of the things that can help. And, of course, since the 1900s, the increase in fat intake has been dramatic. Second thing they found is that milk proteins can be a problem. T. Colin Campbell, in his study, the China study, showed that rats on a high casein protein intake, 20% of their food from casein, if they were exposed to an aflatoxin, a toxin produced by fungus grown in peanuts mainly, 100% of them got cancer. But if their casein, their milk protein intake was 5% or less, and they were exposed to the same aflatoxin, none of them got cancer.
Wow,
And
that's
so
amazing.
it was a strong implication that this was, again, an animal study, but that this could be a problem for humans. And when he looked at the cancer incidence in the villages, where they were basically plant-based, if they looked at the cancer incidence there versus the cancer incidence in the cities, where they had diet animal-based, it was 2 orders of magnitude increase in the incidence of cancer. It was a dramatic increase.
Yeah, and I understand it's not only like the plant-based diet that we'll promote. We'll talk a little bit about some more on other things they can do to promote health. But you were mentioning to me earlier about a study with vegetables and fruits, and would you like to talk about that?
Yes, yes. There is a very good study done. Well, it was a meta-analysis in 2017, and they looked at all-cause mortality. And they looked at people eating fruits and vegetables. And if the people had 7.5 servings of fruit per day, their all-cause mortality over the next 7 or 8 years dropped about 19%, which is a dramatic drop. If the patients had 7.5 servings of vegetables per day, it dropped even more, about 25% drop. And if they had fruits and vegetables, 10 servings per day, the mortality dropped 31% next 7 or 8 years. Now, that was a dramatic drop. Now, they then wondered, well, what about cancer mortality? Let's just zero in on cancer. And they found that if they had 10 servings of fruits and vegetables per day, their cancer mortality dropped 14%. So then they wanted to say, well, was it the fruits or was it the vegetables that had the biggest effect? Well, the problem they ran into at that point was these were 12 different studies. In a meta-analysis, they combined the results. But the definition of what a fruit and a vegetable was varied from study to study. In fact, one study included vegetables in their fruit category. So I had to find one study that had statistically significant results that clearly defined the difference between a fruit and a vegetable. And this study was done in 2014. It was done in England. 65,000 people were surveyed, and they asked them a simple question. They said, what have you eaten in the last 24 hours? And if they ate 7 servings of fruits and vegetables per day, their all-cause mortality dropped about 31%. Actually, that was cancer
Combined.
mortality
Oh.
dropped 31%.
Okay.
The fruits, if they just looked at the people that had 7 servings of fruits per day, their mortality dropped about 7%. That was a trend towards significance, but it was not statistically significant. But when they looked at vegetables, interestingly enough, there was a 24% drop in cancer mortality if they ate 7 or more servings per day. In fact, you could even get that effect if you were eating 2 to 3 servings of vegetables per day, which is pretty easy to do. This was very significant, and it helped prevent cancers. It kind of reminded me of the biblical story of Adam and Eve in the garden, and prior to the fall, they ate fruits and grains, legumes. They ate the plant seeds and the fruits. You didn't have to kill a plant to eat those, and nothing
Right.
died prior to the fall.
Right.
After the fall, notice that God added herbs of the field. These are green things. These are what we would call vegetables today. And I thought, well, why did he add vegetables? Because you have to kill a plant to eat those, the roots, stems, leaves.
Right.
And one possible explanation, again, I don't have proof of this, but one possible explanation is God realized that we are now, after the fall, going to have to fight bacteria, viruses, cancers, and we would need an immune system to do so. And the immune system is strengthened the most, according to this study, against cancer by the vegetable.
Wow. I know it's not our main subject, but maybe some people that are, that are watching might have some other issues other than cancer. And I remember talking to you about diabetes and how a diet can significantly change the results in short amount of time. Can you just briefly talk about that, just so we can?
Sure, surely. In 1927, Dr. Sweeney took 6 medical students. He wanted to give them diabetes. Medical school is 4 years. In 4 years, can you do it? Well, it only took him 2 days. He tested them for diabetes, gave them a sugar pill. Blood sugars rose, stayed below 150, and came back down. They didn't have diabetes or pre-diabetes. This is the glucose tolerance test. Then he fed them 2 days of, and I usually ask people, what do you think you would give someone to cause diabetes? Well, most people say a lot of sugar. Dr. Sweeney, he didn't do this at first. He said, no, I'm going to try oil. He gave them olive oil, creams, butters.
Wow.
For 2 days. Then he retested them. 4 out of 6 blood sugars, when they gave him the sugar pill, went between 150 and 200. That was pre-diabetes. And the other 2 were over 200 at 2 hours, and that was diabetes on the standard glucose tolerance test in just 2 days. He did try the same thing with a high sugar diet for 2 days. He could not produce even pre-diabetes
Wow.
with the sugar. Now, I'm not advocating a high sugar diet, but the key was for diabetes, it was the fats and oils that made them insulin resistant very quickly.
Wow. And then if they were on, if let's say somebody has diabetes, they developed over, after their lifestyle, and they have diabetes, and I've seen cases of reversion. I mean, the people revert that case, that diabetes scenario, by just changing some habits like eating, right? And
Yes, they can. We have seen this frequently. If they've had a new diagnosis of diabetes, their pancreas is still producing enough insulin so that if you get rid of the insulin resistance caused by the fats, their blood sugars can come down. Let me explain a little bit. When you take a sugar or starch, your blood sugar goes up, insulin's released. Insulin is a key which looks for the insulin keyhole in the cells. It's an insulin receptor. Insulin goes in the keyhole, opens the door to the cell, sugar leaves the blood, goes in the cell and gets burned. That brings your sugar down. When we take the fats, particularly it looks like it's the oxidized fats, Those fats go in and they plug up the keyholes. Now when you take a sugar or starch, blood sugar goes up, insulin's released, can't get in the keyholes, blood sugars eventually rise. That's what happens initially, and if their pancreas is still producing enough insulin, a few days, generally, if they go on a total vegan diet that's eliminating the meat, the dairy, and the free oils, within several days, usually the blood sugars start coming down and we have to start cutting back insulin. If they've had diabetes for 10 years, 20 years or so, the second effect happens where the insulin producing capability of the pancreas decreases. It's called beta cell burnout. Those people are now not producing enough insulin, and even though you get rid of the insulin resistance, because they're not producing enough insulin, they may still have to take insulin. However, we have seen patients with beta cell burnout, the beta cells which make insulin, start to regenerate. And in 6 months to a year, many of them, insulin levels can rise again, and they can eventually get off their insulin. We did see a patient, she was blind from her diabetes, had diabetes for many, many years, in a wheelchair because she was very overweight, couldn't walk on her knees because of the weight. And she made all these changes in 2 years. She lost 100 pounds, and in 1 year we had to get her off her insulin because the blood sugars dropped so much.
Amazing. And the reason I ask is because I loved that explanation so much, and I'm sure a lot of people are really glad that now they know this.
I should mention that diabetes is a risk factor for cancer. So if you have diabetes, it's very important to make the lifestyle changes to get your diabetes under control and to help decrease your risk of cancer later.
Yeah, and we're going to talk about juicing, but just before we get into juicing, which is, I've seen documentaries, maybe you have, and it's something that's been more and more common. People talk about that, and something that we use here at the facility. Tell us a little bit about some of the treatments we do here when somebody comes as a cancer guest.
When they come as a cancer guest, the first step is to go on a vegan diet. We kind of walk them through this. Vegan diet, eliminate the meat and the dairy. China study gives some good information that's very helpful. Second step is we increase the vegetable intake. This is from phytochemicals in the plants. We want to increase the amount of phytochemicals, antioxidants that they're getting, and so we want to give them pressed juices. Pressed juices will maximize the amount of phytochemicals they get. The third step would be then, once the immune system is strengthened with the phytochemicals and antioxidants, we want to turn on the immune system, and we do that by raising the temperature. When you get an infection, your body does this automatically. White cells sense the infection, they release chemicals which turn up the thermostat in your brain. Thermostat's set now at 102, but you're at 98.6, you feel cold, you put on a blanket, you start shivering to generate heat, brings the temperature up, and that now at that higher temperature, your whole immune system's turned on. White cells move faster, they gobble up bacteria faster, lymphocytes are produced 20 times faster, interferon and cytokines that have anti-cancer and anti-tumor activity are much higher concentration or more effective. And then once the infection is cleared, the body resets the thermostat back to 98.6. Now you feel hot, throw off the blanket, break out in a sweat, and that brings your temperature down. And that's the normal cycle. In the old days when you had a fever, mom and dad would watch their kid to see when the sweat would break. And when the sweat would come, they'd say, oh, the fever's broken, he's going to get better. In cancer, for some reason, this immune system turn-on many times doesn't happen. And so we generate the same effect by raising the temperature artificially in a hot water bath. Put them in a hot water bath, try to get temperature up, 102, 103 orally for 20 minutes in a tub, and then keep them warm for 40 minutes after they get out. And we can stimulate the immune system as if they've had a normal fever. This can be done locally if it's a local tumor. They have machines now that will focus microwaves on a local tumor, BSD units they're called, or we can do the whole body in a bathtub with hot water. So we do what they call thermal hydrotherapy. We bring their temperature up with a water bath. Fourth thing we do, step 4, would then be intravenous vitamin C. Linus Pauling in 1978 took terminal cancer patients, gave them intravenous vitamin C daily for 10 days, and he increased the mortality, the length of life to mortality in terminal cancer patients from an average of 50 days. That was 1,000 patients that did not have IV vitamin C. They died on an average of 50 days. These patients that got the IV vitamin C survived on an average of 300 days, and 8 of them were still alive 2.5 years later. So we actually share the studies that actually document how vitamin C works. That's another modality that's used at Hartland. And we also do ozone therapy. Ozone has been shown to increase the metabolic rate in cells, their ability to produce energy. We can also do metabolic optimization with thyroid hormones to try to get the metabolism. If it's low, we try to bring it up to optimal levels.
Some people might be asking, like, how is this ozone treatment done? How is it done practically?
Couple ways. We try to get the ozone into the bloodstream. And ozone, what is ozone? You pass oxygen through a little spark plug, and it breaks O2 into O, separates them, and then in nanoseconds it comes back to O2, but a small percentage goes to O3, and that's ozone. And so you can produce ozone with a little ozone machine. You have to produce it locally because it breaks down fairly quickly. I think the half-life, half an hour or so. So you have to use it right away. You can do a rectal insufflation where it's put into the colon and it's absorbed through the membrane there. It's one way. They have vaginal insufflations. Another way of doing ozone is to intravenously, where you just start an IV and you take out about a cup worth of blood in a bag with saline, and then you add ozone gas to it. It turns bright red, and then you just lift the bag up, and it goes back into the person. It's a very simple procedure. When I first heard about it, I thought, oh, this is a bit extreme. I heard it in the auditorium in a big hotel, but after the lecturer said, okay, everybody get a partner. I said, huh? It was simple enough that we actually were able to do it in the hotel auditorium.
Oh, right. Awesome. Okay, let's talk about juicing, but just I'd like to mention here some people from New York, Arizona, Kentucky, Washington Coast, Virginia, more New York. Several people can still say where you're from, and I'll mention here. Now, going into juicing, I'd like to ask, if you please, just put it on the comment there, how many of you actually do juicing on a regular basis? If you have a juicer at home and you do juicing on a regular basis, it would be nice to know if you usually do that. And in the meantime, let's talk a little bit about juicing. Well,
as we mentioned earlier, 2 to 3 servings of vegetables per day decrease the cancer mortality by 24% over the next 7 years or so. So that's to prevent cancer. What about giving vegetables to someone who has cancer? Has that ever been done? Actually, it has been done for over 80 years or so. Max Gerson was the one that actually started this. He was raised in Germany, and he had severe migraine headaches when he was in residency, and he looked for a diet that could cure it. He read in an Italian medical journal that this lady had cured her migraines by changing her diet. So he thought, well, what diet did she change to? The journal didn't say. So he experimented. He said, well, maybe it's food that you can't digest. So I need a food that's very digestible. And he said, well, even babies can digest milk. So he tried an all-milk diet for 10 days, no improvement. He thought, this didn't work. So then he said, well, the digestive tract of a human is very long. Small intestines may be 30 feet, whereas carnivores, it may be only be 10 feet. But vegetarian animals, theirs is about 30 feet or longer. So he says, our digestive tract resembles vegetarian animals, so maybe I should be a vegetarian. So he tried an all-apple diet for 10 days. Applesauce, apple compote, apple juice, dried apples, any kind of apples, and his headaches went away. Then he would add one food every couple days. If the food he was not tolerant to, he'd get a headache in about 20 minutes. But the other foods he could add, and he finally found that a plant-based vegan diet was the one that eliminated his headaches. He used salt. No, he didn't use salt. He used it very sparingly. He then treated other patients with migraines, and they got better. And then a patient with migraines came to him and said, you know, I had my migraines went away, but my skin tuberculosis also went away. Now, this was back early 1900s, where they didn't have a cure for tuberculosis. And he said, well, it must have been something else, because we don't have a cure for that. And then he showed him documentation, no, this was skin tuberculosis. And he says, really? He says, well, do you know anyone else that has skin TB? And he says, well, yeah, down at the TB clinic. And so he started sending his friends down, and they were getting good responses. And then later, they found that other things were responding to it: hypertension, diabetes, obesity, other medical problems were all responding to this plant-based diet. And then finally, 3 terminal cancer patients came to him, and he treated them with the same plant-based diet, and they recovered. Since then, through Institute, the Gerson Institute, they have been treating, you know, thousands of patients with a juicing protocol and getting a response. The only published study was actually in 1995. Gar Hildebrand and Shirley Caven did a comparison study where they looked at the standard 5-year survival for standard medical care at that time for stage 4 melanoma. Now, melanoma is a very lethal disease. Stage 4, it had metastasized everywhere. This is as bad as it gets. The normal 5-year survival, that means after diagnosis, the people that were still alive in 5 years, only 6% were alive with standard therapy. But when they did the juicing protocol and a few other modalities by the Institute, it was 39%, a dramatic increase in survival. So the question then was, well, what kind of juice did they use? How much? They actually used carrot juice. They would do 2 quarts of pressed carrot juice and 1 quart of green drink, lettuce, cabbage, kale, spinach. They've actually got the recipes in their references. And they would take 1 cup of fresh pressed juice throughout the day for a total of about 3 quarts. How did they prepare the juice? They actually used a pressed juice. It's something that grinds up the carrots and the apples into a juicy pulp. You wrap it in a drill cloth, which is cloth kind of like a jean material. It's thick, heavy cloth. Put it in the center of a 15-inch square cloth. Fold it in thirds, this way and that way. You put it in a juice press. A hydraulic press presses that bag, that sack, and the juice comes out. And the question then was, well, you know, well, actually, I asked the question about 10 years ago. We had cancer patients. We were using juicing. And I said, you know, a centrifugal juicer is sure a lot easier, a lot simpler. Why can't we just use a centrifugal juicer? Because centrifugal juicer, it grinds up it spins them on a screen. The force of the centrifugal force pushes the fiber against the screen. The juice is forced through the screen, and the pulp comes out another chute. And that puts a little bit of pressure on it. And in one study, that got, I think, 8 milligrams of potassium out. They did another study where they said, well, let's use a higher pressure machine. This is the masticating juicers. It's a screw which actually pushes the fiber against the screen and pushes the fiber, squeezes it, and the comes out on one side of the screen, the pulp comes out another chute. That increases the pressure, and potassium went from 8 to 16. But then they compared it with, say, a Norwalk juicer, which is a hydraulic press, as I described earlier. And when they pressed it, it wasn't 8 milligrams potassium or 16, it was 32. It had increased, it doubled it, the nutrient extraction doubled again.
Right.
it's not just quantity, there's a qualitative difference. When you put a centrifugal juice on a shelf, the sediment settles out and the fluid on top is clear. With a press juicer, it remains opaque. The press juice has a much fuller, richer body than the centrifugal juicer. But the bottom line was I called the Gerson Institute, who's been, again, doing this for many, many years. I said, well, why can't we just use a centrifugal juicer? And they said, well, we've had cancer patients that don't respond to the centrifugal juicer. When they go to press juice, they start getting a response. And so because of that, even though the juices are much more expensive and take more time, that's really where we moved to. Now, Norwalk, it was replaced by the Pure Juicer. Norwalk juicers aren't made anymore. Pure Juicer is one that's very similar to Norwalk. It's available, but they're very expensive. There is a hand press, Wells, W-E-L-L-E-S, which is a hand press, much less expensive. You use a champion juicer to grind up the carrots, get a juicy pulp, put that in a drill cloth, and then you put it in this hand press, which is just a frame with two pans and a car jack underneath. You pump it up, and it presses the juice. It gets the same results, the more expensive juicers. It just takes a little more work and a little more time. And so I share with patients, if you're running a lifestyle center, get a Pure Juicer, the expensive one. But if you're just doing it for yourself, these hand presses work just fine.
Excellent. And thank you very much. Now, transitioning from talking about juicing and now going back to that experience you had in Guam, where the patients would come back after a while and had the same problems again. And this is one of the reasons why we believe so much in teaching and empowering our guests to have a lifestyle change, because we believe, and in fact, this is what I have here. I brought it with me. It's a compilation of some of our guests that have come here in the past.
Very good.
This is like telling a little bit of the stories, their experiences, their testimonies, and great stories. I've been going through them, and we also have video stories that we've been doing and put it on the channel. Amazing stories. And I've realized that there's a pattern for success. And you mentioned also prayer and devotion briefly, and we will get to that a little bit more, because the way you think and your attitude towards it, and also the spiritual side, the faith and hope, actually have an impact on the healing process. But I've noticed something else. I've noticed that the great results that we had in the past over these many years are related to people that stick with the program. They continue on in their homes, and they can see better results at the mid and long term. And it's not easy, doctor. Sometimes it's not easy, right? Sometimes
it's
people.
A challenge.
It is a challenge, because once they're here, they're amazed that this is a beautiful place. They're treated. They feel like heaven sometimes. They talk about the staff as angels, because sometimes, the world, it's fast. Sometimes they're not treated kindly or whatever the situation, and the routine also for you to have a perfect diet, and then no stress, and the exercise and so forth. So that's why we're including on our programs what we call a health coach. And why we're doing this, exactly to avoid this going back to your routine and not sticking with the program, to increase the success rate, because this is why we're here, because we want to provide people with the best resources possible, so they can be well and they can heal. So the coaching is something that we're really excited about this year.
Amen.
Now the 17-day program, we're going back to this 17-day because we believe that we can be more with them during this time, follow up. They can experience the vitamin C level that is required. I know you mentioned that it takes a little bit about 15 days so they can reach the optimum level. and the fever treatments as well, so they can experience more of that. So that's what we're having this 17-day. Now we're starting something new. Why don't you talk a little bit about the 5-day for training, hands-on, and who will benefit from this?
Well, for a 5-day program, just making lifestyle changes, if you don't have any medical diagnoses, or if you're not on any medicines, you can come through a 5-day program. You really don't need a physician's clearance or anything like that to follow you through it, and you can make the changes that can help prevent diabetes, hypertension, obesity, heart disease. You can make the changes now so that they don't become problems later. If you are on medications and you come through a program like that, it would be important to work with your doctor, someone who's familiar with your medications and how lifestyle can affect your blood pressures, so they can taper you off the medications appropriately. Because the effects are dramatic. We had a patient with hypertension, severe hypertension, came to urgent care in Guam, blood pressure 220/120, and he had a headache, and because it's so high, I saw him in our urgent care. This was in Guam. I said, we need to admit you to the hospital. He said, oh, can you do something here? Well, we were actually able to get his blood pressure down with 3 different medications. I wrote his script out, and he said, am I going to have to be on these the rest of my life? I said, well, it's up to you. I said, if you stop the smoking, the alcohol, go on a complete vegan diet, optimal is without oils, start walking, your blood pressure will come down. We can get you off the medications. And but I caution you, if you start feeling lightheaded, you got to let us know. Give me a call. Well, 2 weeks later, I got a phone call from the hospital saying, that patient you saw 2 weeks ago, by the way, he's a VIP. He was the president of the University of Guam. And he said, he's in our emergency room here at the hospital, and he wants to see you. And I go, oh, what has he done? And I got up there, I heard the rest of the story, and he had actually done something so strange. He had actually did everything we asked him to do. Took a week off of work, made all these changes, stopped the smoking, stopped the alcohol, went on a complete vegan diet, started walking, and he said he took a week off of work, and when he went back to work, his mind wasn't in a fog. He was preventing forest fires rather than putting them out. That dropped his stress level dramatically, and so he was doing very well. But the middle of the second week, he got out of a chair. He felt a little lightheaded. His wife said, call your doctor. He said, call him. He said, I'm going to see him in 2 days. I'll talk to him then. Next day, same thing happened, getting up out of a chair from his car. Felt a little lightheaded. Wife said, call your doctor. He said, I'm going to see him tomorrow. I'll talk to him then. Well, that way was graduation day, and he was passing out diplomas. All the faculty was there. Parents were there. And while he was passing out diplomas, he passed out.
Oh,
so ambulance comes, takes him to the hospital, and that's where I saw him. And I said, I have good news for you and I have bad news for you. Said, good news is you made all those changes. Your blood pressure's come down to normal. I said, well, what's the bad news? He says, the bad news is you're still taking 3 blood pressure medications. Your blood pressure dropped too low and you passed out. So it's just a small caution. If you're making dramatic changes, going to plant-based diet, work with your doctor so he can lower your blood pressures, medicines, or your blood sugar medicines, whatever it is you need, so that your blood pressures don't drop too low and your blood sugars don't drop too low, so that they can taper them off to prevent those complications.
Excellent.
And if you're not on any medications for those, of course, it doesn't need to be adjusted, and you can do this without any problem at all.
Yeah, and one of the ideas for this 5 days, it's not everybody can take 17 days or 2 weeks, and a week, it's more doable. People can take a week off, come, experience the treatments, have hands-on cooking classes, learn how to do the treatments. And by the way, the program is designed for 2 people, so they can come as a pair, a spouse, and then learn on each other. Both learn. It has been proven that when you have someone to be accountable to, or somebody that can do with you, it's much more motivational. It's much more likely that you stick with it. And then there's another aspect that we want to do, but it's for all of the programs, any program, which is an online version of everything we do here. We want to create a very good material, informational, and practical, so people can have access in their homes. So once they come, they learn here, but it might not be enough time. Even if for the 17th day, they might not learn everything, or they might even forget when they go back home. But now they can go back home and have access and continue to listen to them and learn and the lectures and everything, and that's going to be awesome. And for people across the U.S. or across the world that cannot come, perhaps, but still want to learn, they can have access to the online information for a fraction of what a treatment here would cost. So that's also really, really helpful. And one last thing for us to wrap it up is we're starting a new session just this February, the 5th. So we still have vacancies. Some people can still sign up if they want. If you know someone that perhaps is struggling with cancer, or even you or a friend, or you can tell them about Hartland. And I was going to mention that at Emerson's clinic, you also receive guests. Isn't that right?
That's right. It's up near Frederick in Hagerstown, Maryland, and we see patients up there. We do training. If they come from long distance, we can train them in 3 or 4 days. If they're local, next to us, we can continue to give them intravenous vitamin C therapies or thermal hydrotherapy. They can come once or twice a week. We have several patients that are doing that at this time. Also, if they're in the local area of Hartland, they can come back after the program to continue to get treatments long term. And one nice thing about coming to a program, many people who never heard of a vegetarian diet, is kind of a fearful thing, but when they actually come here and taste the food and they say, hey, this food tastes great. This is not the challenge I thought it would be.
I was thinking about that.
It's yeah,
good point.
It's a lot easier.
Excellent.
Actually experiencing it, getting the confidence that you can do this is important.
Yeah, I want many of you that are watching know about us and Emerson's clinic. If you can say, I know, you can tell us, because I've seen some people that signed up. I was looking at their emails, and they're not on the list. Probably somebody referred you to us, and or referred us to you. So you're here now, and I'd like to welcome you. And if you didn't know us before, and we're really open to receive you here to answer your questions. You can answer, and we might not even answer your question right now, but you can write your your questions on the YouTube channel here on the comments, and eventually we'll get to you. We'll answer your questions. We'll send you links. We'll help you out. So don't feel bashful. Just write it down. And I was just going to mention that, okay, we're having a session starting next week. You can still sign up if you want, or if you have somebody that you know that wants to sign up. And we're about to start also the 5-day that can start today and finished on Friday. So you can sign up for those sessions as well. And if you need more information, I'm sure you would want more information, you can contact us. I will put on the description more information about that. You can go back there and look and click, and you will see the Cancer Care website, and we can email each other, so you will not leave you clueless about what we have to offer you, okay? So I'd like to thank everyone. Thank Dr. Emerson for your time, for this effort here, and for doing this to bless more people out there. And this is going to be an effort, a continual program we're hoping to do with you at least twice a month, and then with other guests to talk about other things like hydrotherapy, diet specifically, and mental health. We were going to talk about what the effect of spirituality does, which is a lot, but we ran out of time, so this is a subject for another time, so we hope to talk to you again. And I'm really glad we did this.
Very good. Yeah, it was a pleasure to to be here. You did mention spirituality. They did do a study on spirituality. They actually, mainstream medicine did the study. They looked at the 4 most common diets: the Atkins, Ornish's program, Weight Watchers, and Zone diet. But they looked at compliance with the diet at 3 months and at 6 months after being trained and shown how to do the diet. And on a scale of 1 to 10, at 3 months, it was no better than 5 over 10. And at 6 months, no better than 4 over 10. They said, boy, that's pretty dismal. And the problem is that no matter how good a diet is, it doesn't do you any good if you can't stay on it. In 2007, a woman did a blog called The Daniel Cure, where she wanted people to have a closer walk with God. That was her goal. Health wasn't really the goal, that was a secondary goal. So she wanted to do what Daniel did. Daniel prayed 3 times a day, so she gave everybody a 15-minute devotional in the morning. And then throughout the day, they were on a vegan diet, just like Daniel was. If you read chapter 1 of the book of Daniel, you'll find out about his diet. They trained them how to do this for 21 days. Then at the end of 21 days, they said, now continue it on your own. At 3 months, they asked, how well are you staying on the program? And it wasn't 5 over 10, it was 9 out of 10. And at 6 months, it wasn't 4 out of 10, it was 8 out of 10. So just having a devotional in the morning increased it doubled their ability to stay on the program. And so during a session, we encourage people to develop their own morning devotional so they can get power from on high to follow through on the choices that they're making.
Well, thank you. This is definitely worth talking more about it, and I'm looking forward to talking more about this. Well, thank you. Time's up. This was great, and I hope to see you again. Have a good one.
Amen.
All right. By the way, I wanted to mention. Yeah, I think here.